Hello, are you here for your yearly exam? Wonderful. Are you a new patient? Okay. And let's see, do you currently wear glasses or contacts? Okay. And overall, how has your vision been in the past year? Okay. Let's see. When was your last eye exam? Yeah, that's fine if you don't know the exact date. Do you have any current eye issues? So that could be dry eyes if you use the computer a lot. That could be itchiness, redness, any pain. Okay. History of any eye issues in your family? Okay. And then same for you. Okay. Do you suffer from headaches? Okay. And then what about dizziness? Okay. Any trouble reading? Okay. And then what about seeing things far away? And then any changes in your health? Okay, so pretty good. Good. Okay. Well, we can get started. So you can just get comfortable. You'll just be seated in that chair throughout the exam. The first thing I'm going to do is a visual acuity test, which I'm sure you've done many times before. So I just have this chart here, and I'm going to ask you to just read some lines for me. So first, can you cover your right eye? Good. Can you read this line for me? Good. And now this one. Good. What about the next one? Good. And then anything lower? Good. What color is this? What color is this? Good. Now I'm going to have you cover your left eye and read this line for me. Good. This one. Good. This one. Good. What about the lower one? Good. And then with that eye, can you tell me which is bigger? This circle or this circle? Good. Very good. So now your pupils. Can you look up for me? Good. Get a little bit closer here. Look to the right. Look to the left. And now look down for me. Okay. Good. And now look straight at me. Good. Okay. Very good. So we'll come back to the light in a few moments. First, I just want to do a colorblind test. So I'm just going to show you a few pages in this book. And you're going to just tell me what number you see. Okay? So, let's get one that's not too challenging. Did you struggle with that at all? Okay, good. And any history of colorblind issues? Anything in your family? No. Okay. What about this one? Very good. I'll do one more. What about this one? Very good. Okay. So that was perfect. Now if you would have shown any issues or symptoms of having a colorblind disorder, I would do a more thorough exam, but you seem fine. So now I'm going to have you cover your right eye for me. Perfect. And just look at my nose and tell me how many fingers I'm holding up. Okay? Good. 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 Okay. Cover your other eye and we will do it again. So, how many? Good. 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 Very good. Now for this next test, I am going to dim the lights a little bit. Is that okay? Okay, perfect. So it's a little bit darker. And I'm actually going to have you close your eyes for this one. So you should see a light pass in front of your eyes. And as soon as you do, can you just say yes for me? Alright? Okay. Good. 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 Perfect. So I'm just going to turn the light back on and you can open your eyes. Just going to make a few notes. And are you doing okay? Good. We're almost done. And I forgot to ask, are you interested in seeing any other reading glasses? Maybe a few? Okay. Yeah, I can definitely show you a few. So, I am going to dilate your eyes next. So I just have some drops here. I'm going to put 2 drops in each eye, alright? So I just need you to look up for me. And I'm going to do your left eye first. Okay. 1, 2, good. And now your right eye. 1, 2. Okay, just blink, blink, blink. Very good. And just wipe your eyes a little bit. Okay. Perfect. So I'm just going to give it about 10 minutes and then I'll be back. I just want to look at your eyes up close. Okay? So I'll be right back. So are your eyes blurry? Perfect. So So like I said, I'm just going to look at your eyes up close, and I'm going to look for any optic nerve swelling, and then also any retinal issues, hemorrhages, any retinal tears, things that could be a big concern, okay? And also looking for inflammation. Don't be afraid. These are just all things I look for to be cautionary. So just look directly at me. Very good. Keep your head still. Just gonna look very closely at your eye. Okay. Very good. Okay, let me look at the other one. So, same thing. Very close. Okay, I don't see anything of concern. Okay, look good. So I don't notice anything concerning, which is good. So I think we can move on to glasses. So I do have 2 pairs to show you. And let's see, this is the first pair. So this is a very common pair that sell out a lot in the shop. So I figured I'd show you. And these are just a test pair. So obviously I would fit your pair to your face. So here they are. And they're just plain black, a little bit thinner of a frame and a lens. Here's the side. So kind of texturized. So because they're so light, they're just perfect for reading. Do you want to try them on? Perfect. Let's see. Okay. Yeah, they look really good. So yeah, I could just fit them a little bit better for you. And then, let's see, I'll take them off. And there's actually one other pair I wanted to show you, but I'm actually wearing them, so I'll just take mine off and have you try them on. So these ones are very light as well, and they're just plain black, so a simple frame. They are larger than the other pair though, so where the others were a rectangle shape, these are more square. Okay? So let's have you try them on. So yeah, just a little bit bigger. What do you think? You like these ones? Now, would you be actually interested in purchasing? Maybe? Okay. So then why don't I go ahead and take some measurements for you? Perfect. Actually have my measuring tape right here. So it's actually just a few measurements, nothing crazy. Just want to make sure they're adjusted so they don't fall off your face. So we'll get you this exact pair made in the exact measurements. Alright? So let me begin. Let's see what I need here. So first I will measure the space between your pupils. So let's see. And this might seem like an odd thing to measure, but it's to make sure we know where the center of your lens should be. So just look directly at me. You can blink. I'm just going to measure this very precisely. Okay. Let me check this one. just want to make sure the lens are exactly where they should be. Okay, good. And then next I'm going to measure your space between your outer eye and the top of your ear. So I'll start with your left ear here. And just get that. Okay. And now your right ear. Let's see here. Okay. Perfect. And then let's see what else. Guess I'll do your width and height of your eyes. And then that's it. I told you it'd be easy. So the width of your left eye. Very good. Okay. And then the width of your left eye. Okay. Perfect. And I think I'm actually also going to just do your top ear to your top ear, just so we have it. Last one, I promise. Okay. Good. Looks like just about 10 inches. Perfect. So 10 inches. Down 10 inches. Then we have the other measurements. So I'm going to put the order in for those glasses now. And what's nice is we do have them in-house, so they should be ready for you by tomorrow, I'd say. And I will have you try them on when you pick them up to just make sure they fit perfectly. And if any adjustments need made, we can obviously do that further, okay? So I'm gonna not need to see you for an exam until next year, which is good news. Now obviously if something were to pop up, any eye dryness, eye redness, itchy, watery eyes, vision changes, anything of concern, you call me right away and we'll get you in, okay? And we are open on weekends as well, so you always get a hold of us no matter what. Then I'll give you a call as soon as your glasses are ready and you are all set. So thanks so much for coming in, and I will see you soon when you pick up your glasses.